The corridor of St. Gabriel Medical Center went silent, as if someone had cut the power to every sound. Visitors stopped walking. Nurses froze in mid-step. 2 orderlies stood beside a gurney and simply stared. At the center of that sudden stillness, a man in a dark green dress uniform stood at attention. Silver stars glittered on his shoulders, 3 on each side. His ribbons filled the left side of his chest in neat, perfectly aligned rows. Lieutenant General David Harrington raised his right hand to his temple in a precise formal salute. He was not facing a flag or a superior officer. He was saluting a woman in blood-speckled scrubs and a wrinkled white coat hair, pulled back ID badge clipped to her pocket. Doctor and Fam General Surgery. Her gloved hands were still damp from scrubbing. There was a faint streak of dried blood near her collar where the gown had not fully covered. Her eyes were steady, almost too calm for a hospital hallway full of witnesses. For a heartbeat, no one breathed. Anne did not move. Then she set the chart in her hand on the nearest counter, straightened her shoulders, and returned the salute. The motion was clean and sharp muscle memory that had nothing to do with residency training. The general held the salute for a slow count, his jaw tight, eyes fierce and bright with something that was not quite gratitude and not quite anger. When he finally lowered his hand, his voice carried through the corridor without needing to be raised. "I owe you 2 lives, doctor," he said. "My son's and one you saved a long time ago." No one spoke. Somewhere a monitor beeped from a nearby room, thin and insistent. Anne dropped her hand, her face unreadable. Fluorescent light hummed overhead. The general took 1 step back as if remembering where he was. A nurse exhaled loudly, the sound almost a gasp. 3 weeks earlier, no one knew her name. 3 weeks earlier. St. Gabriel woke before the sun. At 6:20 in the morning, the surgical conference room on the 4th floor was already overcrowded. 15 residents lined the walls, coffee cups balanced on knees, tablets glowing with open charts. A sticky note on the door read in someone's neat handwriting, "Please do not steal the chairs. We only have 6. Dr. Adrian Holt stood at the head of the table with a tablet in one hand and a paper cup in the other. His dark hair was silver at the temples cut short. 30 years of surgery had carved permanence into the lines around his mouth. "All right," he said. "Case 1, 48-year-old female right upper quadrant pain low-grade fever positive Murphy sign." He tapped the screen. An ultrasound image appeared on the wall monitor. Anne stood in the back corner where the whiteboard frame made a natural shadow. She held her tablet in both hands, elbows tucked in as if making herself smaller would make her less noticeable. Her badge still felt new against her chest. 2nd year. 35. New to this city, new to this hospital, older than most of the residents by several years, and treated so far like a substitute teacher no one expected to last. "Dr. Tran," Holt said. At the far side of the table, Dr. Mitron straightened. She had tied her black hair into a tight bun and lined up 3 pens by color beside her notes. 3rd year, top of her class, the kind of resident who answered questions before they were fully asked. "Symptomatic cholelithiasis," Mai said. "Gallbladder wall thickening stones visible. She is a routine candidate for laparoscopic cholecystectomy. 4 ports critical view identification cystic duct and artery clipped and divided." Holt nodded once. "Standard," he took a sip of coffee. "Who wants the case?" 2 of the junior residents lifted their eyes, then looked away quickly. No one spoke. Routine gallbladders meant long, thankless cases often used as practice for whoever the attending wanted to punish or test. Anne kept her gaze on her tablet, scrolling through the list of overnight admissions. Her instinct honed long before residency was simple: if no one assigned you a target, you did not volunteer to stand in the open. Holt let the silence stretch. Finally, he smiled without warmth and turned toward the back of the room. "Dr. Pham, you have been quiet since you arrived. What do you see?" Heads turned and looked up slowly. On the monitor, the gallbladder was frozen in grayscale. The stones were obvious. The bile ducts cascaded off to the left in thin threads of shadow. She stepped forward 1 pace so she could see the screen clearly. "The gallbladder is inflamed," she said. "The stones are small clustered near the neck. The cystic duct looks slightly wider than normal." Mai shifted her weight, frowning. Holt tilted his head. "Der how? It has a fusiform dilation just before it joins the common bile duct," Anne said. She kept her voice even. "That pattern can indicate intermittent obstruction. I would want to rule out choledocholithiasis before proceeding." "The ultrasound report says there are no common duct stones," Holt replied. "Radiology cleared it." Anne glanced once at the text on the monitor, then back at the image. "Static ultrasound can miss small stones," she said. "The outer duct contour is not smooth. I would order an MRCP. It will not delay her long, and it may change the plan." The room went quiet. One of the first years coughed into his sleeve. Someone else stopped mid-sip of coffee. Holt stared at her for several seconds. A muscle jumped in his jaw. "Are you suggesting," he said lightly, That our radiologist and I both missed something you saw in 6 seconds from the back of the room. Anne met his eyes. I am suggesting a confirmatory scan would be prudent, sir. The last word came out crisp. It hung in the air in a way that did not sound quite like hospital etiquette. Mai looked down at her notes. Color rose along the edges of her cheekbones. Holt set his coffee on the table with care. All right, he said. Since you feel strongly about caution, you can demonstrate it in the operating room. He tapped his tablet. The display on the wall updated, adding a line to the assignment list. Cholecystectomy room 4, Dr. Pham primary. Dr. Keller is attending of record if he bothers to show up. The rest of you will assist on cases where the surgeons trust your judgment. A few residents exchanged quick glances. One tried and failed to hide a smile. Next case, Holt said. The meeting rolled on. Anne sank back into her corner, the heat of attention dropping away. She pulled up the full chart for the gallbladder patient, scrolling through labs history allergies, one finger moving in small economical motions. No one spoke to her when the conference ended. Residents filed out, herded by pagers and checklists, leaving behind the smell of coffee and the faint squeak of the old chairs. Anne stayed seated until the room was empty. It was an old habit. Moving last meant fewer eyes on your back. When she finally stood, she adjusted the blue cap over her hair. For an instant, as the elastic dragged against her skin, the fabric rode up at the nape of her neck. The tattoo there caught the harsh fluorescent light. It was small, no bigger than a coin. A serpent twined around a vertical blade wing spread behind it, all coded into clean black lines that looked almost geometric. To most people, it would be an odd, vaguely medical design. To certain people, it was something else entirely. In the doorway, a tall man in a Navy security jacket paused. Lum Quang had been on his way past the conference room, a ring of keys clipped to his belt, jingling softly with each step. He was in his 50s, broad-shouldered, his posture still straight in a way that did not come from walking hospital halls. His eyes flicked to the back of Anne's neck. For a moment, the bored patient expression of a hospital security chief vanished. The lines around his mouth tightened. His gaze sharpened, recognition sliding into place like a puzzle piece that had been missing for years. Vector Medical Response Unit. He had seen that emblem once before on a file, stamped classified on a casualty report, from a valley with no name on any public map. Anne tugged the cap back down, unaware of his stare, and picked up her tablet. She turned toward the door, almost colliding with Lum. Sorry, she said automatically. No problem, doctor, he replied. His voice was neutral. His eyes were not. For a heartbeat, he studied her face as if matching it to a photograph he had seen long ago. Good luck in room 4, he added. Thank you, Anne said. She stepped past him into the corridor. The smell of disinfectant and stale coffee wrapped around her. The day was already moving, and the gallbladder in room 4 was waiting. Behind her, Lum remained in the doorway. He glanced once more at the space where the tattoo had been, then at the empty conference room. The faint echo of Holt's voice still seemed to hang in the air. He closed the door gently and walked away, his mind turning over a name he had not heard spoken in years. Room 4 was already humming when Anne stepped through the scrub line. The anesthesiologist sat at the head of the table, adjusting tubing with practiced boredom. The scrub nurse was a woman in her late 50s with cropped gray hair and an expression that said she had seen every flavor of resident mistake and no longer found any of them interesting. Gallbladder, she said without looking up. Dr. Pham, yes. Yes, Anne replied. She washed at the sink, counting under her breath, fingers, palms, forearms, the motion so ingrained it did not require attention. The water was lukewarm. The smell of chlorhexidine clung to her skin. Inside the operating room, the monitors glowed pale green against the white walls. The patient lay draped except for a small rectangle of bare skin under the rib cage. The anesthesiologist nodded at Anne. Vital steady, Kai, he said. You are clear to start whenever you are ready. Thank you, she replied. She took her place at the table. The scrub nurse moved to her side, instruments laid out in perfect order. Attending, and asked. Dr. Keller is on call, the nurse said, which usually means he is in his office filling out paperwork and pretending he cannot see his pager. Her tone held no malice, just the flat amusement of long experience. Anne glanced once at the door. No one appeared. Scalpel, she said. The first incision was small, a careful cut, below the costal margin. The skin parted cleanly, and worked through subcutaneous tissue with gentle pressure exposing the fascia. Her hands did not hesitate. She placed each trocar under direct vision, watching the tip of the needle enter on the laparoscopic screen to avoid injury. The nurse watched her with a slight narrowing of the eyes. You have done a few of these, the woman said. Anne kept her gaze on the monitor. I have had good teachers, she answered. Gas expanded the abdomen. The liver came into view, a smooth, dark curve. The gallbladder lay tucked beneath it, inflamed and pale, the fundus mottled. And angled the camera, searching along the hepatocystic triangle. There, near the cystic duct, the thin tubular shadow of the common bile duct ran deeper than the rest. "What is your plan, doctor?" the anesthesiologist asked lightly. "Standard 4-port approach," Anne said. "And I want to look at the duct." She exposed Kello's triangle layer by layer, dissecting patiently until the cystic artery and duct stood out thin structures against the yellow fat. The cystic duct was indeed ever so slightly fuller than it ought to be. She could have ignored it. "Cholangiogram set available?" she asked. The scrub nurse nodded already, reaching for the tray. There was a brief flurry as the circulator confirmed the equipment and cannulated the cystic duct with steady fingers, injected contrast, and watched the duct fill on the fluoroscopy screen. A small defect appeared in the flow, a smudge interrupting the clean white column just above the ampulla. A stone exactly where she had expected it. "Well, look at that," the anesthesiologist said. "Radiology missed one." Anne did not smile. She proceeded methodically, using a slender, flexible scope to confirm the stone then basket extraction to tease it free. Each step was efficient, nothing wasted. The scrub nurse anticipated her needs before she spoke, placing instruments where Anne's hand would be next without conscious thought. When it was over, the ducts looked clean, the gallbladder came away in one piece, and the incisions were small, neat, almost delicate. "Time from incision to closure," the anesthesiologist said, checking his watch. 53 minutes, not bad for a resident primary. The scrub nurse eyed Anne as she tied the last knot. "Where did you say you trained Dr. Pham?" she asked. "County General," Anne replied. The nurse lifted an eyebrow, unconvinced, but she did not press. Anne stripped off her gloves in the scrub room afterward and watched the water run pink down the sink. Her reflection in the steel backsplash looked unfamiliar in the hospital cap and mask. She dried her hands, checked her pager, and moved on to rounds, then consults, then a stack of progress notes that did not care how many ducks she had cleared that morning. By noon, the story of the gallbladder had begun to move in quiet circles. It started in the OR lounge when the anesthesiologist told another attending over coffee that the new second year pulled out a duckstone radiology mist. It continued in the residence workroom where an intern mentioned that Dr. Holt had assigned a routine case only to have it turn complicated, and someone else pointed out that the complication had been caught before it hurt anyone. By evening, the version that reached Dr. Mitron was sharper at the edges. In the residence locker room, Mai changed out of her scrubs with quick, efficient movements. Another third year, Ravi sat on the bench behind her, absently scrolling his phone. "You hear about the cholecystectomy in room 4, he asked. Mai snapped her locker shut. "What about it?" Coy said the new second year did a cholangiogram and pulled a stone. Radiology did not see it on ultrasound. Holt has been replaying the footage all morning. Mai frowned. "Maybe she just got lucky," she said. Ravi shrugged. "Maybe," he replied. "Or maybe she's one of those weird savants. Old career change, done surgery somewhere else, who knows?" "She is a second year," Mai said. "If she had more training, her file would show it." She sounded very certain. She did not feel it. Later, when the locker room was empty, Mai sat alone in the dim light from the half-asleep fluorescence and opened her tablet. She keyed in her login and pulled up the video archive, searching for room 4 morning block. The recording loaded. She watched Anne from the observer's angle camera fixed high in the corner of the ceiling. The way Anne held the scope was not the tentative grip of a novice. It was balanced fingers, relaxed control fine enough that the image hardly wobbled when she moved. The sutures at the end were identical in length, and spacing the knots falling to the same side each time as if a ruler had been laid along the skin. My paws zoomed in on a frame, enlarged the image until the pixels blurred. Her chest tightened with a mix of irritation and reluctant respect. "You are not a second year," she muttered at the screen. "So who are you?" There were no answers in the video, only the quiet certainty of someone who had done this more times than any official log admitted. 2 days later, Anne was on call when Huang Long came in. He was 20 years old, a thin university student with an oversized backpack and a nervous habit of twisting the strap between his fingers. He sat hunched on the edge of the emergency bed, sweating through his t-shirt, one hand pressed to the lower right side of his abdomen. "Pain started when?" Anne asked. "Yesterday afternoon," he said through clenched teeth. "At first I thought it was something I ate, then it got worse. I almost did not come, but then I could not straighten up." She palpated his abdomen carefully. Guarding tenderness at McBurney's point rebound? Classic. His temperature was mildly elevated, heart rate a little fast, blood pressure holding. The CT scan done in the early hours when the scanner was free showed an enlarged appendix with surrounding fat stranding. Nothing shocking. Labs revealed a white count of 14, slightly high, and a lactate bump that the emergency physician had chalked up to dehydration. On paper, it was a straightforward case. Anne stood by his bed after reviewing the scans, the faint hum of the overhead vent filling the short silences. "Appendicitis," she said. "We will take your appendix out laparoscopically. Small incisions, faster recovery. You will likely be home in a day or 2. Long nodded, jaw tight. "Is it dangerous?" he asked. "Every operation carries risk," Anne replied. But this is one of the most common surgeries we do. You came early. That helps. He tried to smile and failed. As she spoke and inhaled a casual breath that carried with it the scent of his sweat and the metallic hint of something sour beneath. Not strong, just there, like a memory of blood left too long in warm air. She looked at the CT image again, this time not as a diligent resident reading findings, but as someone searching for misdirection. The fat around the appendix looked more edematous than usual. There was a smear of fluid along the pelvic brim that the radiologist had called nonspecific. The bowel gas pattern was slightly off. Her gut, that instinctive knot that had nothing to do with protocols, tightened. She walked out to the station and found Dr. Jonas Keller at the computer. He was in his late 40s, sandy hair thinning expression, perpetually distracted. His reputation in the department was clear, competent, safe, more interested in not being sued than in doing anything ambitious. Dr. Keller, Anne said, about Huang Long and Bay 6. He did not look up immediately. Appendix, yes. He replied. I saw the scan. Again, straightforward. I am concerned he may have early perforation, Anne said. The fluid around the appendix, the degree of fat stranding his lactate. It is subtle, but combined with his exam and the smell, I think he may already be leaking. Keller finally swiveled to face her. The smell, he repeated. There is a particular odor when pus begins to spread in the peritoneum, Anne said. It is not something that shows up on a report. Keller sighed. Dr. Pham imaging does not suggest free air or a large collection. His vitals are stable. I appreciate that you are thorough. However, we cannot call every appendicitis a perforation because it feels off. If we plan for a simple laparoscopic case and find purulent fluid everywhere, we will need to convert quickly, Anne said. I would like to be prepared. You will be prepared, boy, Keller replied. You will have instruments, assistance, and anesthesia. We do not need to label this as a perforation before we are sure. She held his gaze. At least consider broadening his antibiotics preoperatively, she said. Keller hesitated, then tapped at the keyboard. Fine. Piperacillin tazobactam, he said. But on my note, this is an uncomplicated appendectomy. I do not want administrative questions about why we upcoded the risk category based on a hunch. He turned back to the screen, effectively dismissing her. Anne walked back to Long's bed. He watched her approach, eyes large in his thin face. They are going to put you to sleep, she said. You will not feel anything during the operation. I will be there the whole time. He swallowed. Have you done many of these? He asked. Her mind flickered through images that did not belong to this clean white hospital. Tents lit by the portable lamps, dirt underfoot, a boy not much older than Long groaning on a stretcher with a rigid belly and eyes glazed by pain. Yes, she said. Enough. He seemed to relax slightly at that. In the operating room, the routine settled over everyone like a familiar blanket, and scrubbed, gowned, and gloved took her place at the table, inserted the first trocar, and watched the camera slip into the open space of the insufflated abdomen. The monitor filled with pale organs and glistening surfaces. She swept the scope toward the right lower quadrant. There in the middle of the field, the appendix lay curled swollen and angry red. A thin stream of cloudy fluid oozed from a rent near the tip and pooled in the pelvis. Further up, fat was matted with fibrin. The picture was unmistakable. Ruptured, she said quietly. The scrub nurse, younger than the one from the gallbladder case, sucked in a breath. This was supposed to be simple, he murmured. It is not, Anne said. Suction, we are going to need more than a standard lap setup. She moved with sudden speed, her earlier caution replaced by the calm of action. The suction wand cleared the worst of the pus. The laparoscopic instruments began to feel clumsy, too limited for the debridement the cavity needed. Convert, she said. Extend the periumbilical incision 2 centimeters. Get me a proper retractor. Call for an extra pair of hands. The nurse hesitated. Did Dr. Keller approve conversion? He is not here, Anne said. The patient is. Retractor now. There was a beat of indecision, then training overrode doubt. The nurse passed what she asked for, and widened the incision with swift, precise cuts, and inserted the retractor. The open view gave her the access she needed. She worked quickly, removing the necrotic appendix, irrigating until the fluid ran clear, checking for additional contamination. 10 minutes into the open portion of the case, Keller appeared in the doorway, mask already tied, eyes taking in the changed scene. I see we converted, he said. Perforated appendix with generalized contamination, Anne replied without looking away from the field. There was no time to wait. He opened his mouth, then closed it again as he watched her hands move through the familiar sequence of steps. For a moment, curiosity replaced irritation. The pattern of her sutures, the way she tucked the stump, the way she assessed each loop of bowel, it all spoke of repetition far beyond 2 years of residency. When the case was over, Long was stable and his abdomen was clean. The incision was longer than planned, but Anne had closed it with the same even military neatness she brought to every wound. In the morning conference, Holt pulled up the case summary on the monitor. Huang Lung, he said, admitted with presumed uncomplicated appendicitis. Intraoperative findings: perforated appendix with early peritonitis. Dr. Pham converted from laparoscopic to open and completed the procedure without complication. A few residents shifted in their seats. Mai watched Anne from across the room. Holt continued. Radiology missed the signs. The lab values were borderline. Dr. Pham suspected a higher severity and adjusted antibiotic coverage accordingly. The patient is recovering in intermediate care. That is good work. There was a murmur of acknowledgement. Anne kept her eyes on her tablet. Holt set the tablet on the table. However, he said, the decision to convert to an open procedure was made before an attending arrived. That is a problem. Anne looked up. The contamination was extensive, she said. Every minute we stayed limited by the laparoscopic view increased the risk of missing pockets of infection. By the time an attending reached the room, we would have lost that time. It is not only about time, Holt replied. It is about structure. Supervision exists for a reason. I was the surgeon in the room, Anne said. It was my responsibility to make the call. The silence that followed was heavier than the ones before. Holt held her gaze for a long moment. After rounds, he said at last, my office. He moved on to the next case. The residents shifted again, the unspoken understanding passing through them, and sat very still, hands flat on the table, face impassive. Inside, something that had slept for a while stirred the part of her that remembered other rooms, other fights over who was allowed to decide who lived and who did not. Outside, the hospital carried on. Monitors chimed, pagers buzzed. Somewhere on another floor, Lum Quang checked a security camera feed and paused briefly on the image of a small woman in scrubs walking alone down a corridor toward the wing where the chief's office waited. Holt's office was smaller than his reputation. The walls were crowded with framed diplomas and conference posters that had begun to curl at the corners. A single window looked out over the parking lot where the morning sun bounced off windshields in hard white flashes. A stack of journals leaned precariously beside the computer. Anne stood in front of the desk, hands loosely at her sides. She had taken off her white coat somewhere between the conference room and here. Without it, the scrub top made her look even smaller. Holt sat behind the desk with his elbows on the armrests, fingertips touching. He studied her as if she were a case he could not quite classify. You have been here how long now, Dr. Pham? He asked. 7 weeks, Anne said. In 7 weeks, Holt replied. You have contradicted imaging twice-adjusted antibiotic coverage without waiting for an attending converted a laparoscopic case before consulting the surgeon of record and performed at a level that does not match a second-year resident. He did not say it as a compliment. Anne kept her gaze on the edge of the desk, a point where the wood veneer had chipped away to reveal a pale strip beneath. My goal is to match the needs of the patient, she said. Sometimes that requires moving quickly. Your goal, Holt said, is to practice within the structure of this program. We do not have residents making independent decisions as if they were trauma attendings. He opened a folder on his desk and recognized her own photograph clipped to the top corner. Your file is interesting, Jake, he went on. County General for Residency, decent board scores, commendations from attendings there. Before that, medical school at Northridge. Standard. What is less standard are the gaps. He tapped the page. 3 missing years between undergrad and medical school. 2 more in which you are listed as working with a non-governmental organization in unspecified conflict zones. The background check we run on all hires picked up something else. He pulled out a printed sheet and turned it so she could see the heading. Department of Defense Personnel Registry. Anne's throat felt dry. We found you in a government database, Holt said. Medical classification, no details but enough to flag. Why would a civilian doctor show up in that system? I volunteered with a group that partnered with military units for security, Anne said. In some regions it is standard. They may have logged us for coordination. Her voice did not waver. She had rehearsed this half-truth in quieter rooms long before St. Gabriel. Holt watched her face. That is your explanation, he said. It is the truth that is on record, she replied. He sat back, the chair creaking. I do not like mysteries on my service, Fioa, he said, especially not mysteries that cut into chain of command. Anne did not answer. Regardless, Holt added, closing the folder, I cannot ignore results. Huang Long is alive because you acted quickly and correctly. That buys you some benefit of the doubt. He leaned forward again. But hear me clearly. You do not convert cases or escalate care beyond your credentialed level without notifying the attending. If I have to hear from a nurse that my resident has opened a patient before I even make it to the department, we will have a serious problem. And met his eyes then. If I had waited yesterday, she said, Long would have had more infected fluid in his abdomen. The risk of abscess prolonged stay further surgery would have increased. Holt's jaw tightened. It is not that I disagree with your assessment, he said. It is that you keep making those assessments alone. He lifted a hand before she could respond. We are done for now. I expect you to respect the structure here. Go. Anne walked out into the corridor. The air felt cooler than inside the office. For a moment she stood with her back against the wall, eyes closed, listening to the distant sounds of the hospital carts rolling, someone laughing too loudly near the nurses' station. Her pager buzzed against her hip. She checked it. Trauma Bay, all residents. The call was in 3 short tones, repeated twice, a pattern everyone at St. Gabriel had already internalized. She pushed off from the wall and headed for the stairs. The trauma bay on the ground floor had 3 resuscitation rooms and a central work area that always seemed too small on days like this. When Anne arrived, nurses were already pulling crash carts into place. A respiratory therapist checked ventilators. Someone turned on the overhead speakers. Static crackled, then the clipped voice of the charge nurse. All units, we have incoming from Fort Ashton Training Range. Reported explosion during live fire exercise. 6 casualties, 3 critical, estimated arrival 10 minutes. Holt strode in, pulling on gloves as he walked. Mai fell in beside him, tablet in hand. Tran, you take trauma 1, Holt said. Arterial bleeds first. Patel trauma 2, fam trauma 3. Anne nodded. Trauma 3 was the least equipped of the bays. Fewer monitors, fewer booms, the room usually assigned to the so-called stable patients. It fit a pattern she had already noticed. When in doubt, keep the strange new resident where she could do the least harm. The ambulance sirens reached them in a faint, wavering howl that grew louder with each passing second. Then they cut off. Engines rumbled. The double doors at the end of the hall swung open as the first gurney burst through, pushed fast by 2 medics in dusty uniforms. Trauma 1 incoming, someone shouted. The bay filled with motion. Orders layered over each other. Blood pressure readings, oxygen levels, names, ages, a mechanism of injury. The air smelled of smoke, sweat, and the metallic tang of fresh blood. Anne's patient arrived second. A young man in muddy camouflage pants and a green undershirt lay strapped to the gurney, eyes closed but moving under the lids. Dark hair stuck to his forehead. His skin had that chalky paleness that spoke of pain more than blood loss. Name is Ryan Harrington, the lead medic said. 22, close range exposure to device, multiple shrapnel wounds to chest and arms, no obvious arterial bleed. Pressure was 90/60 on scene now, up to 100 after fluids. Heart rate 110, GCS 14. Any loss of consciousness? Anne asked as they moved him onto the trauma bed. Brief, the medic said. He was disoriented for maybe 30 seconds, then fully oriented, denied trouble breathing, complained that his chest hurt, and slipped stethoscope earpieces into place and listened. Breath sounds were equal, though a bit shallow. No obvious wheezes or crackles. Heart sounds were fast but present. The nurses cut away his shirt with scissors. Dozens of small wounds pocked his chest, each with a ring of blackened skin where the metal had burned its way through. Some were shallow, only dimpling the fatty tissue. Others were deeper. As Anne examined them, she reached for a pair of forceps and gently teased one fragment free. It was a dark, irregular shard of metal about the size of a fingernail, edges ridged, surface pitted with corrosion. Not the clean, smooth alloy of modern training devices, old steel that had seen weather and time. These were decommissioned charges, the medic said. They told us they were safe. Anne turned the fragment between her fingers, remembering the feel of similar pieces dropping into metal bowls and tents half a world away, remembering the labels on crates stenciled in a language not her own. What exactly were you using, she asked. The medic swallowed. Simulated improvised devices, Hikke. Oz, he said. Inert. Or they were supposed to be. And set the fragment into a tray and moved her hand along Ryan's right chest. Near the lower sternum, just to the right, she found a wound that felt different. The skin there was swollen in a small, tense bulge like the beginning of a blister under the surface. That one hurt more than the others, Ryan said through clenched teeth as she pressed near it. The monitors showed his pressure slowly trending down despite fluids. Heart rate rising bit by bit. Chest X-ray, Anne said. Portable now. 12 lead EKG, cross-match, and hold. She stepped back long enough to glance across the bay. In trauma, 1 Mai stood over a soldier with blood soaking the sheets under his leg, barking for more clamps. In trauma, 2 Patel called out a rapid sequence intubation. Holt moved between the rooms, checking, nodding, redirecting. Anne caught his eye and raised her voice just enough. Dr. Holt, she said. My patient Ryan Harrington. The shrapnel is not from training devices. It is old ordnance. The fragment pattern is consistent with live devices. 1 piece is near his right ventricle. I am concerned about migration. Radiology will confirm if anything is near the heart, Holt said, already half turned back toward trauma 1. For now, he is stable. Clean what you can and admit him for observation. We will escalate if needed. His pressure is dropping and his heart rate is climbing, Anne said. We should treat him as if the risk is real. Many trauma patients have borderline vitals on arrival, Holt replied. Our resources are not infinite. Handle the obvious injuries first. Do not chase ghosts when we have legs to amputate. He walked away before she could answer. Anne looked back at Ryan. His eyes were open now, staring up at the ceiling tiles. Am I okay, Anthony? He asked. You are in the right place, she said. We are going to take care of you. I want you on a heart monitor, and I'm going to order chest films every few hours. If you feel more pressure, more difficulty breathing, anything worse, you tell the nurses immediately. He swallowed hard. Yes, ma'am, he said. The ma'am hit her in the chest for a moment, dragging an echo of another voice saying the same word in a different uniform. She pushed it aside. At the nurses' station outside the trauma rooms, she entered the orders including telemetry and serial imaging. The charge nurse, a woman with tired eyes and a kind smile, read them over her shoulder. That is a lot of monitoring for someone with superficial chest wounds, the nurse said. It may not stay superficial, Anne replied. Please make sure he stays on this floor, not the overflow. The nurse nodded. There was something in Anne's tone that did not invite argument. As they wheeled Ryan toward the elevator to the surgical ward, a familiar figure appeared near the doorway. Lum Quang watched from the hall, arms folded. You picked the quiet one, he said when Anne stepped past him. He is not quiet, Anne said. He is early. Lum walked beside her for a few steps. That medal, he said, looked old. It is, Anne said. Like Corvalold, he asked. The name hung between them like a wire pulled taut. Anne's jaw tightened. That is not a place in my vocabulary anymore, she said. He looked at her, seeing more than the scrub top and the badge. Maybe not, he replied, but it is in mine. I was attached to a recon unit there. Your unit helped evac a few of my people when communications went dark. She did not answer. Thiuta, he added quietly. She stopped walking for half a second. The stretcher rolled on without her. Then she moved again. I am not that rank here, she said. Yes, she said. I am a resident. Forget the rest. He gave a short, humorless laugh. People around here may forget, he said. Metal does not. It keeps coming back. Several hours later, the trauma bay had emptied. 2 soldiers were in the operating rooms upstairs. One was in the intensive care unit. The others, including Ryan, had been scattered across the wards. Anne sat at the corner of a nurse's desk on the surgical floor, finishing notes. The fluorescent lights buzzed softly overhead. Afternoon sun slanted through the small window at the end of the hall, painting a bright strip on the polished linoleum. Her pager vibrated against her hip. She glanced at it. Code blue, room 412. Her heart jumped. 412 was Ryan Harrington. She pushed back her chair so fast it skidded. The nurse at the desk looked up in surprise as Anne was already running down the hallway, sneakers slapping the floor. The door to 412 was open. Inside, 2 nurses hovered at the bed. A crash cart sat pulled to the side, its drawers gaping. The monitor screamed a high-pitched alarm. Ryan gasped for air, eyes wide-skin ashen. His blood pressure on the screen read 70/40 and falling. His heart rate was 140 and climbing. Jugular veins stood out along his neck. Dr. Keller stood on the opposite side of the bed, stethoscope pressed to Ryan's chest, brow furrowed. He was fine 20 minutes ago, one nurse said. Then he pressed the call button and said he could not breathe. Breath sounds are decreased, Keller muttered. Possibly a tension pneumothorax. Get a needle kit. Anne moved to the bedside, placing her fingers along Ryan's sternum, then sliding them to the right. The small swelling below his 4th rib felt larger, now tight, the skin stretched. Doctor, Keller said sharply, if you are going to stand there, get out of the light or make yourself useful. His trachea is midline, Anne said. There is no hyperresonance. Listen again. She shifted her stethoscope quickly. Breath sounds were present, though shallow. Heart sounds were distant and faint, muffled beneath the frantic rhythm of the monitor. Ryan's eyes found hers. Help, he whispered. His lips had turned a faint blue. Cardiac tamponade, Anne said. The fragment has migrated. Blood is filling the pericardial sac. Keller stared at her. You cannot know that without imaging, he said. We need to get him to the operating room and let cardiothoracic handle it. He will not survive the transport, Anne said. We are 4 floors up and the elevator is slow. His pressure is falling right now. Look at him. The monitor showed 60/30. The waveform jittered. At that moment, Holt appeared in the doorway, drawn by the code alarm. What is happening? He asked. Acute decompensation, Keller said. Breath sounds questionable, likely pneumothorax. We are preparing for needle decompression and transfer to the main OR. It is not a pneumothorax, Anne said. It is tamponade. The piece in his chest moved. We need an emergent thoracotomy here. Holt's eyes flicked from Keller to Anne to the patient. You want to open his chest in a ward room, he said slowly. Yes, Anne said. Absolutely not, Holt replied. We are not in a field tent. There are sterile protocols, there are equipment needs, there are consent issues. Consent is implied in a code situation, Anne said. Equipment is in the crash cart. Sterility is enough for what we need. He is dying now. The monitor beeped again. The blood pressure dropped to unreadable levels. The line flattened for a heartbeat before flickering back into a thin, trembling trace. A nurse called out, "He's losing pulses." Keller reached for the needle in the tray. Anne stepped past him and grabbed the handle of the crash cart, yanking it closer to the bed. She pulled open the drawer with the emergency surgical pack, tearing the sterile wrapper with quick, efficient movements. "Dr. Pam," Holt said, his voice suddenly cold, "you do not have authorization to perform a thoracotomy in this setting. If you proceed without it, you will be suspended or worse." Anne looked at him. "Then you can fire me after he has a heartbeat," she said. She turned to the nurses, cut away the gown, clean the right chest from nipple to sternum and from clavicle to mid-abdomen. "Drape what you can, suction on. I need a scalpel rib spreader and a pericardial clamp." They moved, partly from training, partly from the force in her tone. Holt stood frozen for one breath, then another. This was his ward, his staff, his liability. It was also his patient, his responsibility. The decision was taken from him when the monitor let out a continuous alarm. Ryan's heart rate plummeted. The pulse oximeter flatlined. "We are losing him," the nurse whispered. Anne took the scalpel in her hand. Her world narrowed to the rectangle of skin in front of her, one clean incision along the right fifth intercostal space parallel to the rib. The blade slid through skin and subcutaneous tissue, then muscle, then the firm resistance of the intercostal plane. The smell of blood and cautery hit the air. She switched tools using a blunt instrument to separate the ribs. The rib spreader clicked as she opened it, metal protesting quietly. Inside, beneath a thin layer of shining pleura, the pericardium bulged pale and tense like a balloon stretched to its limit. "Pericardial sac is distended," she said. "This is tamponade." She picked up a smaller scalpel and made a short incision in the pericardium. Dark blood poured out in a sudden rush, soaking the drapes. The pressure on the heart released. For a moment there was no change. Then the monitor blipped, catching a beat, then another. The line began to form a rhythm again. "Blood pressure coming up," one nurse said, voice shaking. 40/20, 50, and gloved hands slid into the opening she had made. Her fingers closed around something hard embedded in the soft tissue near the right ventricle. She worked it free and brought it out into the light. The fragment lay in her palm, wet with blood. It was larger than the others, its edges sharper, its surface marked by the same pattern she recognized from long ago. "This is not training metal," she said quietly. "This is live device shrapnel." She dropped it into a stainless steel basin. It hit with a clear metallic ring. Everyone in the room looked at her. Keller's face had gone pale. Holt's mouth was a thin line. Anne continued to work, placing a few quick sutures to tack the pericardium open so it would not refill, checking that the bleeding had slowed, that the heart moved freely in the space she had created. Her voice came out low and even. "Major Enfam," Bouchy said. "United States Army Medical Corps, Vector Medical Response Unit, 3 deployments, 800+ combat surgeries." The words felt strange in the wardroom, too heavy for the beige walls and the buzzing fluorescent light. They hung there nevertheless. A figure appeared at the doorway, out of breath, in a way that came from more than climbing stairs. The man wore a tan uniform shirt under a dark jacket, with no insignia visible, as if he had dressed in a hurry. His hair was graying at the temples, his stance rigid from years of command. "Where is my son?" he demanded. "You have my vows in," he demanded. Holt turned. "Sir, you cannot be in here," he began. The man's eyes swept past him and locked on the open chest, the blood the woman in hospital scrubs with her arm buried to the wrist in his son's rib cage. For a brief second, something like recognition flickered across his face. "Ryan," he said. Anne did not look up. "His heart is beating," she said. "He is not out of danger, but he is alive." The man took a step forward. A nurse moved to block him by reflex, then hesitated at the look in his eyes. "Who are you?" he asked Anne. "Dr. Pam," she said, "surgical resident." "That is not what I meant," he said quietly. Outside in the hall, Lum had arrived, pulled by the overhead announcement and the commotion. He stopped when he saw the man in the doorway. "Harrington." He breathed too soft for anyone else to hear. "Lieutenant General David Harrington." Anne finally lifted her head. For a heartbeat their gazes met. His eyes searched her face, tracing lines he seemed to recall from another place, another time. They narrowed slightly. "Forward Operating Base K-12, he said. "Corval Valley, winter. A medic and a surgeon held a line in a makeshift theater for 16 hours. They kept 12 of my people breathing while we waited for airlift that never came on time." His voice was hoarse. "Were you there?" he asked. The smell of dust and cordite and cold air flooded back into Anne's mind. The shape of a valley ringed by low hills. The sound of rotors that arrived too late for some and just in time for others. "Yes, sir," she said. The general took in the bloody gloves, the improvised operation, the fragment glinting in the basin. His jaw clenched. "You did not wait then either," he said. Anne did not answer. Behind him, Lum stood very still, watching both of them, seeing the past wrap itself around the present in a hospital ward that had never expected to be this close to a battlefield. A nurse cleared her throat softly. "Doctor," she said, "his pressure is 65/40 and rising, heart rate coming down to 120. Anne looked at the monitor, then back at the open chest. "We have temporary control," she said. "He needs a formal closure in a proper operating room and chest drains. Prepare to transport." She withdrew her hand carefully, checking once more that the pericardial opening would not seal again. The heartbeat against the thin edge of tissue no longer strangled. "We will pack the incision, cover it, and move," she told the team. "Keep the fluids running. Call cardiothoracic, tell them he is coming now." The nurses moved with a kind of stunned efficiency, hands shaking but accurate. One of them began to wrap the rib spreader with sterile towels for transport. General Harrington stood where he was, hands clenched. "Sir," Holt said, finding his voice at last, "we need you to wait outside. We will update you as soon as your son is in the operating room." Harrington did not look away from Ryan's face for several seconds. Then he nodded once and stepped back. He stopped beside Anne. "Do not let him die," he said quietly, and met his eyes. "I'm trying very hard not to," she said. He held her gaze as if searching for a lie. Whatever he found seemed to satisfy him for the moment. He turned and walked into the corridor. Lum shifted to the side to give him room. The general did not appear to see him. The next 20 minutes blurred. Trauma staff arrived to assist with the transfer. The elevators were cleared. A path was kept open between the ward and the operating suite. People who had never seen an open chest outside an anatomy lab pressed themselves against the walls to avoid the gurney that carried Ryan half-draped, patched with makeshift dressings and humming machinery. Anne walked at the head, one hand on the makeshift covering over the rib spreader to keep it from shifting the other on the side rail. Inside the operating room, the world narrowed again to light and steel and the rhythm of a beating heart. Cardiothoracic took over the field, but Anne stayed scrubbed in. She answered questions about timing and sequence, about the amount of blood that had come from the pericardial sac, about how long the heart had been without perfusion. No one asked why a second-year resident had been the one to open the chest in the first place. When the last suture was tied, the drains secured and the dressings in place, Ryan was stable on multiple drips, a ventilator breathing for him. The anesthesiologist read off numbers that finally sounded less like a countdown and more like a plan. They wheeled him out toward the intensive care unit. In the waiting area outside the ICU, the fluorescent lights seemed harsher than in the operating room. The chairs were plastic and uncomfortable, arranged in rows that never quite lined up. General Harrington stood when he saw them coming. The uniform jacket was gone. He had rolled his shirt sleeves up, revealing forearms corded with age and effort. It made him look more human and somehow more dangerous. "How is he asked. "Alive," as Anne said. "The fragment punctured the pericardium and created a tamponade. We relieved the pressure and removed the object. The damage to the heart itself was limited." "So he will recover," Harrington said. "There are still risks," Anne replied. "Infection, arrhythmia, post-operative complications, but the immediate crisis has passed." Harrington exhaled in a long, controlled breath. "Thank you," he said. The words were stiff, as if dragged through a throat more used to issuing orders than gratitude. Anne nodded once. "It was my job, she said. Holt stood a little back from them, hands in his coat pockets. His eyes moved between the two, taking in the charged stillness. "General," he said, "we can set you up with a consultation room while your son is settled into the unit. The ICU staff will let you know when you can see him." Harrington did not move. He looked at Anne again, then at the tatters of crimson on her scrub top, the faint spatter of blood on her forearms where the gown had ended. "You are the same," he said. "King," he said. Anne did not ask what he meant. "In Corvalto," he continued, voice low but clear. "You refused to abandon the staging area. They said the incoming fire was too heavy, that you had to fall back. You told my operations officer that unless the wounded started walking by themselves, you were not moving." A muscle jumped in Anne's cheek. "I do not recall the exact wording," she said. "I do," Harrington replied. For the first time since he had entered the hospital, his expression shifted into something like a bleak smile. "It is a very particular feeling," he said. "Watching someone under your nominal authority ignore the safe option and do what needs to be done anyway." "Safe is relative," Anne said softly. He studied her for another long second. Then without another word, he stepped away and followed the ICU nurse down the hall. Holt let out a breath. "Come with me," he said to Anne. "Administration is already asking questions." They ended up in a conference room on the 3rd floor. The room smelled faintly of burnt coffee and old carpet. A long table dominated the center, surrounded by chairs that had seen better years. A projector hung from the ceiling unused. The blinds were half closed against the afternoon glare. Dr. Huang Yim was already there, tablet under one arm, suit jacket unbuttoned. She was the hospital's vice chief of clinical operations, which in practice meant she spent most of her time worrying about lawsuits, public relations, and the fine print on contracts. She looked up as they entered. "Dr. Holt," she said, "Dr. Pam." Her gaze lingered on the streaks of dried blood on Anne's sleeves. "You did not have time to change," she observed. There was a code, and said. "I am aware," Nihim replied. "The overhead alarms were quite clear. Please sit." Anne remained standing. Neem shrugged and took a seat herself, placing the tablet on the table in front of her. "I have reviewed the preliminary report, she said. Patient Ryan Harrington admitted following an explosion at Fort Ashton training range. Multiple shrapnel wounds. Experienced acute decompensation on the surgical ward. Dr. Pam initiated an emergency thoracotomy in a non-sterile environment without attending authorization." Anne heard the words without reaction. "He was dying," she said. Neem raised a hand. "I will let you speak," she said. "In a moment. First, I need to outline the situation for clarity." She turned to Holt. "Lieutenant General Harrington is an important figure," she said. "We have an existing arrangement with Fort Ashton for training-related casualties. The paperwork on that arrangement is very specific. Our protocols are very specific. Today, those protocols were not followed." Holt did not flinch. "Without the thoracotomy, his son would likely be dead," he said. "You can put that in your outline." Geem's expression hardened. "That is not the point," she said. "It is exactly the point," Holt replied. They stared at each other across the table. Anne spoke into the brief silence. "He had signs of tamponade," she said. "Elevated neck veins, falling pressure-muffled heart sounds. There was no time to move him." "You could not know with certainty that it was tamponade?" Neem said. "I have seen it before," Anne said, "many times." Neem narrowed her eyes. "Yes," she said, "about that." She tapped the tablet. A file opened, the reflection of its contents flickering across her glasses. "Your military involvement," she said, "or rather the lack of mention of it in your application." "I left that part of my life," Anne said. "My record was sealed when I separated. I disclosed what was legally required." "You disclosed nothing," Ngim said. "We had to find your name in a Department of Defense registry by accident. We hired a second-year surgical resident. It appears we also hired a former frontline combat surgeon without being told." "Would you have hired me if I had led with the combat surgeon part?" Anne asked. "That is not the question here," Ngim said sharply. "It is mine," Anne replied. Holt rubbed his temples. "Hoai," he said. "We can have the philosophical argument another time. Right now we have a general whose son is alive because of a decision this hospital would never have officially sanctioned." Ngim pressed her lips together. "Which means," she said, "that if he chooses to make this a public story, we will be praised as innovative heroes or criticized as reckless amateurs, depending on which angle the media favors. Either way, Dr. Pam's actions will be under scrutiny." Anne listened, the words falling into a familiar pattern. Different setting, same undercurrent. Optics. Liability. "I did what was necessary," she said. "If you want me to sign something acknowledging responsibility, I will." "We are past that," Ngim said. "This is not just about you. This is about the institution." Lum pushed open the door without knocking. He wore his security badge on his belt and the same navy jacket, but his presence filled the small room in a way that had nothing to do with his official role. "You were not invited," Ngim said. "Respectfully, Doctor, I came anyway, Lum answered. "You will want to hear this." Holt gestured toward an empty chair. "Sit," he said. Lum stayed standing. "I served 3 tours as a reconnaissance attachment," he said. "Last one was in the Corville Valley. I have seen what happens when people wait for perfect conditions before they act." He nodded toward Anne. "What Dr. Pam did today," he went on, "was textbook tactical medicine. She identified a lethal condition, weighed the risks of movement versus immediate intervention, and acted in the window where it could make a difference." Neem crossed her arms. "This is not a battlefield," she said. "No," Lum replied. "Here no one is shooting at us. That means we have more luxury, not less. Luxury of equipment, of backup of time, but the heart does not care if a bullet or a piece of metal got to it on a training field or in a war zone. It only cares whether the pressure around it is relieved in time." The room went quiet for a moment. "Dr. Pam," Holt said, "why did you not tell us the full extent of your background?" Anne stared at a spot on the table where someone had scratched a groove into the laminate. "When I left the service," she said, "I wanted to practice medicine without carrying the weight of every decision made in a tent. I did not want to be the person people whispered about in hallways. I wanted to be judged on what I did here." "You are being judged on what you did here," Holt said. "That is the problem and the solution." He stood pushing his chair back with a soft scrape. "I owe you an apology," he added. "I dismissed your concerns twice. About the gallbladder. About the appendix. Today I almost dismissed this. Each time you were right." Anne looked up. "I am not keeping score," she said. "I am," Holt replied. Neem sighed, the fight draining slightly from her shoulders. We have to decide how to handle this, she said. The report, the internal review, the inevitable questions. We frame it accurately, Holt said. Critical situation resident with prior relevant experience, immediate life-saving action. Protocols will need to be updated. Updated, Neem repeated. Holt turned to Anne. You are not a second year in any meaningful sense, Hiveidazosai said. On paper, yes. In reality, you have more trauma experience than anyone else in this building. Anne said nothing. I want to formalize that, Holt continued. I am prepared to recommend that you be elevated to a senior trauma surgeon role with full operative privileges and that you help design a training program for the rest of us based on what you know. Neem stared at him. You cannot be serious, she said. I am, Holt replied. If we pretend we have not seen what we saw today, we are lying to ourselves. If we pretend we cannot learn from it, we are foolish. He looked back at Anne. You left tactical medicine, he said. I am not asking you to go back to the desert. I am asking you to bring the useful parts of that world into this one. The hum of the ventilation system filled the pause, and thought of the valley of the cold of the bodies that had left on the last helicopter and the ones that had not. She thought of Huang Long's narrow bed and the gallbladder patient smiling groggily when she saw her family unaware of the stone that might have been left behind. What exactly would you want from me? She asked. A simulation-based trauma training track, Holt said. Morning sessions, case reviews, hands-on drills. Teach residents and attending surgeons how to recognize the quiet signs and how to make decisions under pressure without freezing. Neem rubbed the bridge of her nose. This is not something we can implement overnight, she said. There are accreditation issues, funding questions. Then we start small, Holt said. Pilot it here, measure outcomes. If it fails, we adjust. If it works, we will not need to advertise. The numbers will speak. Anne looked at Lum. You think this is a good idea? She asked. He smiled faintly. I think if someone is going to teach our young doctors how not to waste time when it matters, it should be the person who made a hallway look like a surgical suite and kept a general's son alive, he added. She said. She turned back to Holt. I have conditions, she said. Neem made a soft noise. Of course you do, she said. First, Anne said any program we build has to be open to veterans transitioning out of service. Medics, corpsmen, flight nurses. Their field time should count for something. No one gets turned away because their experience does not fit a neat civilian box. Agreed, Holt said without hesitation. Second, and continued, Lam is the coordinator. He understands both sides. You want tactical realism. He is how you get it. Lum blinked. That was not the role I expected to walk into today, he said. Then say no, Anne replied. He thought for a moment. I'm not saying no, he said. Third, Anne said, looking at Neem now, my military record stays sealed unless I choose to disclose it. No press conference, no glossy brochure. What I did before is mine. What I do here is enough. Neem considered her. You are asking a lot, she said. You are getting a lot, Holt answered before Anne could speak. Finally, Neem nodded. I can work with that, she said. We will need to be precise in how we document everything, but yes, for now this stays internal. Holt extended his hand across the table. Then welcome to the senior staff, Dr. Pam, he said. Anne looked at his hand for a second, then took it. His grip was firm and warm. I will need time to design something worth doing, she said. You have the rest of your career, he replied. Start with Monday. Later, when the meeting broke and the chair scraped back and the overhead lights snapped off, Anne stepped into the hallway with Lum beside her. Do you regret opening him up? He asked. She shook her head. No, she said. I regret that it took this much to make anyone listen. They walked in silence for a few paces. Through a window at the end of the corridor, she could see a narrow strip of the ICU wing. The blinds were drawn in Ryan's room, but she could picture him there, pale and motionless under the tracing of wires, heart still beating under the bandages she had helped place. Tomorrow, Lum said, they will be calling you something different. Doctor, she asked. That, he said, and other things. She touched the back of her neck where the tattoo sat hidden beneath the edges of her scrub top. They can call me what they like, she said. I will still be in the trauma bay at 6. The next morning at 5:55, the lights flickered on in an unused procedure room on the second floor that had been cleared of stretchers and stocked with simulation mannequins. Monitors blinked awake. A metal cart held airway tools and IV equipment. 2 plastic torsos were rigged with hidden pumps that could spill artificial blood onto the floor when triggered. Anne stood in the center of the room with a clipboard and a pen, the first outline of a curriculum forming in her mind. At 6 exactly, the door opened. Maitran stepped in, hair pulled back tighter than usual, eyes sharp. You said 6 I said. I am here. Behind her came Ravi and Dewey, the former field medic, who had joined St. Gabriel's emergency department last month, and still moved like someone who expected explosions. Anne nodded to each of them. Today, Baj, she said, we start with 4 patients and not enough hands. They listened. In the ICU down the hall, Ryan Harrington slept, his heart beating steady against the inside of his chest, the space around it finally his own again. The first simulation was messy. The mannequin on bed, one gurgled mechanically, plastic chest rising and falling too fast. Its monitor flashed a heart rate of 140 and an oxygen saturation in the low 80s. The scenario card taped to its wrist read, blunt chest trauma, possible tension pneumothorax. Bed 2 had a pale, motionless figure with abdominal distension and a rapidly falling blood pressure. Bed 3 and 4 waited under thin sheets, their screens still blank. Mai stood between beds, 1 and 2 eyes moving from one monitor to the other. Sweat beaded along her hairline. Pick one, Anne said from the foot of the room. We can split, Mai replied. Ravi can take one, I take the other. You have 1 attending and 1 resident, Anne said. 2 nurses, 4 critical patients. The helicopter is 20 minutes out. Decide. Dewey, standing near the supply cart, shifted his weight. The old habits of triage were carved into his posture. He kept his mouth shut. This was not his call. Mai looked at the gurgling chest, then at the swollen abdomen. She stepped to bed 2. Hypotension, rigid abdomen, cool, clammy skin, she said out loud. We can give fluids. We cannot fix internal bleeding here. He needs surgery. We stabilize and ship. She turned to Ravi. Get 2 large bore IVs, instart a liter bolus, call the OR, tell them we are coming with probable splenic injury. She moved back to bed 1. Tension pneumo kills faster, she said more to herself than anyone else. Airway first. She grabbed a needle kit from the cart, felt along the mannequin's synthetic ribs until she found the target space and slid the needle in. The mannequin's chest hissed as programmed pressure released. The oxygen saturation on the screen climbed a few digits. Anne watched, arms folded. Why that order? She asked. Mai did not look up. Because the one with the belly can still talk, she said. The one who cannot move air does not get to talk much longer. The exercise continued, plastic bodies and simulated fluids combining with very real adrenaline. When it ended, 2 of the 4 patients survived on the screen. The other 2 did not. You missed the compartment syndrome in bed 3, Anne said when they were done. You stabilized the fracture, but you did not recheck distal pulses after the leg swelled. In a real scenario, you might save his life and lose his limb. Mai stared at the motionless mannequin. I thought I had time to go back, she said. Time is never what you think it is, Anne replied. You will look again next time. Dewey met Anne's eyes. You set this up like a forward aid station, he said, not like an orderly emergency room. Some days, Anne said, this hospital feels more like the first than the second. They ran the scenario again with different parameters, then another and another. The room filled with barking orders, confused crosstalk, resigned curses, and slowly, gradually, the noise became less frantic and more focused. Word spread. In the weeks that followed, more residents asked to join the early morning sessions, and capped the number per group, preferring a smaller knot of people she could push hard rather than a crowd that could hide. Holt dropped in one morning and stood quietly at the door, arms crossed, watching as Ravi argued with Dewey about whether to attempt a thoracostomy in a simulated hallway. Afterward in the corridor, he handed Anne a folder. Preliminary data, he said. She flipped through the pages. The numbers were not dramatic at first glance, but clear when she knew what to look for. Fewer minutes between door and incision in trauma laparotomies, lower incidence of missed injuries, more consistent early antibiotic administration. Too soon to declare a pattern, Holt said, but enough to make me optimistic. Anne closed the folder. People are less hesitant, she said. Once they have seen the worst cases here, the real ones do not feel as alien. Some of them have nightmares after your sessions, Holt said. So do some of us after real call, Anne replied. He allowed himself a brief, tired smile. I got a call from Fort Ashton this morning, he said. They want to send their medics to observe, and General Harrington has requested a formal meeting. For what purpose? Anne asked. You can ask him yourself, Holt said. He is on the visitor's log for this afternoon. When the afternoon came, the ICU was quieter than the day of the code. Ryan Harrington lay in a step-down bed, now no longer in full intensive care. The chest tubes were gone. The bandage on his right side was smaller, the edges neatly taped. The monitor still trailed wires from his chest, but the numbers they displayed were pleasantly boring. He looked less like a victim and more like a very young man wearing hospital socks and an expression halfway between boredom and impatience. General Harrington sat in a chair by the window, his posture slightly less rigid than before. There were shadows under his eyes, but his clothes were pressed and his shoes polished. Anne paused at the door before entering. Ryan noticed her first. Dr. Pham, he said. I remember your voice. The rest is kind of fuzzy. That is common, Anne said. Your body was busy doing other things. He snorted softly at that, then winced and put a hand to his ribs. Do not make me laugh, he said. It hurts. Pain is a sign that nerves are intact, Anne said. In this case, that is a good thing. Harrington stood. Doctor, he said, thank you for coming. Anne nodded. I needed to check his incision anyway, she said. She moved closer, gently lifting the edge of the bandage. The wound was clean, no sign of infection. The skin around it was slightly bruised, but the underlying tissues felt firm and healing. Looks good, she said. Ryan watched her with curiosity. They told me what you did, he said, in the room before the OR, and replaced the bandage. They told you a version, she said. You were not in great shape to see the details. Apparently you had your hand in my chest, Ryan said. My friends are never going to let me forget that. They might, Harrington said dryly, if they wish to keep their training privileges. Ryan rolled his eyes, then looked at Anne again. I do not remember much, he said. But I know I was scared. Then there was this feeling like something was pressing down on me, and suddenly it got lighter. I could breathe, then nothing. When I woke up, they said you had been the one to do it. He hesitated. I do not really know how to say anything that does not sound stupid, he added, so I will just say thank you. You already did, Anne said. Then I am saying it again, he replied. Harrington watched the exchange with an expression that was not quite softened but less severe. I requested a meeting with your administration, he said to Anne. I wanted to make sure they understood what you are worth. That is not necessary, Anne said. They are very aware of what I am worth, in many senses. I am sure, Harrington replied, but this goes beyond one hospital. He reached into his jacket and took out a slim folder similar to the one Holt had handed her, but with a different seal on the front. Headquarters is reviewing our combat casualty training programs, he said. There is interest in integrating more of the kind of decision-making you seem to specialize in. They want consultants. I have recommended you. Anne did not take the folder right away. I left, she said. I did my tours. I came home. I am building something here. I'm not asking you to sign up again, Harrington said. This is not about deployment. It is about design, curriculum, advice. Advice that will be used where it was not last time, Anne said. Harrington's jaw tightened. A lot has changed since Korvalwicke, he said. Some of it because of what we learned there. Some of it in spite of it. I cannot promise perfection. I can promise that if you do not speak other people with less understanding of the cost will, and thought of the battlefield surgical tent of the nights when she had argued over radio channels with voices that did not hear the sound of the wounded around her. She thought of the simulation room down the hall of Mai's clenched jaw as she chose one mannequin over another. I am already teaching people here, she said. And you can keep doing that, Harrington replied. Consulting does not take that away. It adds reach. Ryan watched her silently, his eyes moving between his father and the surgeon who had opened his chest. My dad is not very good at asking nicely, he said. That is not his job, Anne replied. Ryan smiled faintly. Mine neither, he said. But I know a little about training. Before this, I thought the exercise at Ashton was just another drill. We treated it like a chore, something to get through. People take shortcuts when they treat things like that. They skip checks. They assume. He tapped his chest lightly. I am here because somebody assumed, he said. If what you do makes them think twice before assuming, then I hope you say yes. The room felt smaller for a moment. Anne took the folder. I will read it, she said. That is all I ask, Harrington replied. He picked up his cap from the chair. Do not work too hard, he told Ryan. Recovery is your only assignment. Yes, sir, Ryan said. You too. When they left the room, Harrington walked beside Anne down the corridor. May I ask you something, he said. You can, she said. Do you regret Korvalda, he asked. Not the decisions, your presence there at all. Anne considered. I regret that I did not have better tools, she said. Better support. I regret some of the names I remember and some I do not. I do not regret being there instead of somewhere safe while other people bled. Harrington nodded slowly. Then perhaps this is a way to tilt the balance, he said, even slightly. He stopped near the ICU desk. Whatever you decide, Kikoi. He added, you have my respect and my gratitude. Those are heavy things to carry, Anne said. You seem used to weight, he replied. He left after that, his footsteps fading into the general noise of the unit. In the months that followed, the simulation program grew. Nurses began to sit in on the sessions, then paramedics, then a radiology fellow who admitted that understanding how decisions were made at the bedside might make her reports more useful. The hospital administration, after initial hesitation, found it appreciated the improvement in metrics. Fewer complications meant fewer complaints. Happy statistics looked good in reports. Sometimes late in the day, when the regular cases had thinned and the afternoon lull settled in, Anne would find herself standing in the empty simulation room, watching the silent mannequins. The echoes of earlier shouts seemed to cling to the walls. She met with a small cluster of officers in plain suits in a conference room one floor above. They brought slides and questions. She gave them cases and counter-questions. She described what happened when people waited too long to act and what happened when they moved too soon without thinking. She insisted on scenarios that felt uncomfortable ones where the right choice was never perfectly clear. At the end of one long session, a colonel with a tired face said quietly, "We ask a lot of our medics. We rarely give them tools like this." Anne replied, "Give them tools, then listen when they say they need more." Back at St. Gabriel, the work did not let up. On a rainy night in late autumn, the sky outside the hospital was the color of old steel. Water streaked the windows. The emergency department waiting area was crowded with damp coats and umbrellas. Anne was halfway through a hastily reheated cup of soup in the doctor's lounge when her pager vibrated sharply. Trauma alert, multi-vehicle collision, all available surgeons to the emergency department. She set the cup down, wiped her hands on a paper towel, and headed for the stairs without thinking. On the trauma side, the doors were already open. A paramedic shouted a report as the first gurney came in, a young woman with a crushed pelvis. Another followed with a middle-aged man, unconscious neck in a brace, bits of glass still clinging to his hair. Mai was there, gloving up, face set. Dewey stood at the head of a bed, readying a bag valve mask. The charge nurse rattled off incoming numbers. "Dr. Pham," she said, "we have at least 3 more on the way. 1 with penetrating chest trauma, unknown source." Anne pulled on a gown and gloves, the motion smooth. "Assign Mai to the pelvic fracture," she said. "She knows the protocols. Dewey with Ravi on airway. I will take the chest." She moved to the far bed where an empty monitor waited its line, a flat patient horizontal. Her heart rate quickened not with dread but with a familiar clarity. A few years ago, this level of noise would have dropped her back into a desert, into cold nights and rotor wash. Now it was simply what she did. Someone wheeled in the final patient, a man in his 30s, with a blossoming stain spreading across his shirt. The paramedic kept pressure over the wound, his gloves bright red. "Stab to the left chest," he said. "Lost pulses for a few seconds and the truck got them back. Pressure is hanging on. He needs help now." "On 3, Anne said. 1, 2, 3. They slid him onto the trauma bed. She listened, probing quickly, fingers finding the spaces between his ribs. The monitors came alive, beeping in jagged rhythm. Her world narrowed to skin-bone muscle and the silent ticking of the clock in her head. "Scalpel," she said. The nurse put it into her hand without question. The hallway outside the trauma bay filled with shadows and shapes. Somewhere in another part of the hospital, the simulation mannequins lay motionless, a training ground that had fed this moment. In the corner of the trauma bay, unnoticed by most, Lum leaned against the wall watching. His eyes moved from Anne's hands to the faces of the younger doctors, measuring how they stepped into place. At some point in the blur of movement, his gaze settled briefly on the back of Anne's neck, where her scrub collar had slipped low. The serpent and blade of her tattoo showed clearly now, black against pale skin, no longer hidden, no longer covered out of reflex. He smiled to himself, a quick private thing. Anne did not see it. She traced the path of the wound with her fingers, planned the incision, and drew the line in her mind. "All right," she said. "Let us begin." The instruments gleamed under the lights. The monitors sang their thin electronic song. Outside, the rain beat against the windows. Inside, between one heartbeat and the next, she went to work. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.